Another busy year for our health and wellbeing policy priority programs. Back in January, as part of our first podcast of the year, we focused on 10 tips for a healthy 2024. Dr. Michelle Hardy-Murphy reminded us that it all starts with being kind to ourselves.
Being negative on yourself can hold you back from achieving what you want to achieve in your behaviour change.
Our weekly podcast series was a big feature of the year, and we were fortunate enough to have a deep conversation with HSE CEO Bernard Gloucester, who shared valuable insights about health and wellbeing and his own work after a year in the job.
The reason that paragraph was written was to describe the need for integrated care. And so I keep saying to people, there are books written the world over on integrated care. Some of them are fantastic, some of them probably not so. But the point is, I keep saying, look how simple Mrs. O'Neill's ask is. Just look how simple it is. And look at how complex we've made the response.
Yeah.
And my job is to take the complexity out of the response so that Mrs. O'Neill gets what she needs.
As part of a webinar we hosted in March on brain health, Professor Brian Lawler told us our brains are our greatest asset.
Well, as I said before, I think our brain is our biggest asset. I think, and we've talked about this today, our brains are plastic. I don't mean plastic, I mean we have plasticity, and that means that they're capable of adaptation, modification and repair, and we've heard a lot about this. So we can grow connections in our brains, we can build connections between our neurons right across our life course, not just as a kid, but as a younger person, an adolescent, in midlife, and even in later life. You still have brain plasticity. Yeah, you can grow your brain through stimulation, education, exercise, and of course, social connection.
We launched the new National Physical Activity and Sedentary Behaviour Guidelines. These are called Every Move Counts. And we were joined by the Chief Medical Officer from the Department of Health and had great representation from a range of target groups for the guidelines at a photo call in Dublin on the day of the launch. 2024 also marked a major milestone, as this year Ireland celebrated 20 years of the workplace smoking ban, which our then Taoiseach played a key role in.
But it's had a huge impact, I think, on heart disease, on lung disease, on ear, nose and throat conditions, particularly for bar workers and people in the hospitality sector, and in terms of stroke. And then in terms of the impact on lives, many people speak very positively about the absence of smoke in the workplace and in hospitality. And then for people with conditions like asthma, cystic fibrosis, I remember early on parents of children with those conditions saying, for the first time ever we can go to a hotel, for the first time ever we can go to a pub with our kids for a sandwich or whatever, which we couldn't have done before that.
Back on the podcast channel, we covered a wide range of topics and had many voices on, including Martin Davern from the Sexual Health Centre.
And I think one of the lovely things about this area is the level of collaboration that happens across that space. And that an awful lot of that is down to the Sexual Health and Crisis Pregnancy Programme leading out on this area, an area that maybe is an intimate part of a person's life, but because of that, often requires advocates and voices and people to bring it into public domain.
One of the flagship programs whereby we want to embed health and wellbeing conversations and brief interventions into the way the health service talks to patients and service users is the MEC program, or Making Every Contact Count.
I found the workshop was a great tool to be able to practice the techniques that we were going to use with our patients. Topics like this can often be hard, particularly as I always used to think that I might jeopardize the therapist-patient relationship. But actually, after completing the course, I found that I had new tools and techniques and different ways to address it in a friendly, approachable and safe way, so that I was able to maintain that relationship but also make those changes for the patient.
Part of our work from the Healthy Eating and Active Living programme is focused on parents and how to support a healthy weight for children. Here is Professor Anne-Marie Hourihan.
I suppose the first thing we have to do is make sure that we avoid blaming parents and bringing them on board as being part of a solution rather than part of a problem. And then focusing on healthy behaviours, because weight and health are they're sides of the same coin, really. And I suppose for me it was really about bringing up or reflecting that I had a health concern.
For World Mental Health Day, we focused on health service staff and got support from the CEO to promote 10 tips for World Mental Health Day in the workplace, in conjunction with HSE Human Resources. We had a very busy November with the launch of the Men's Health Plan. Earlier, back in June, we supported Men's Health Week and had men getting health checks and information in a variety of places, from men's sheds to the local communities to agricultural marts down in Kerry. The great Rob Carney joined us on our Men's Health Week webinar, sharing some simple advice, not just for men.
You know, I'll go back to my previous point of you know, having that little bit of self-awareness and taking time out of every day to look back at your day and to incorporate the things that made you happy or made you feel a little bit healthier, and bring it into your next day. And above all else, this is my biggest thing when I was playing. Sleep is your best friend. It's so regenerative. It does everything good for you. Make sure you're getting as many hours sleep as you can.
In the Irish Museum of Modern Art, we ran the Traveller Wellbeing Through Creativity Showcasing event in conjunction with HSE, Social Inclusion, traveller organisations, Creative Ireland and the Arts Council.
This funding is vital to local projects and should be available yearly to allow projects in the local community a chance to promote, celebrate and grow.
Our alcohol conference, organised in conjunction with HSE Public Health, took a focus on research, bringing together colleagues from academia, health service and NGOs.
You're all very welcome to this conference on integrating evidence and action, shaping the future of alcohol research.
Lots we didn't get to mention there, but I just want to thank everybody for helping us during the year with all the work, and thanks especially to those who help us communicate the work. Hope you have a lovely Christmas and a Happy New Year.